So each year we invite an elite group of trainees to join our cardiology training program here in the heart of downtown Los Angeles. And we provide a very comprehensive program in all aspects of all cardiovascular disciplines. At the heart of our program is that our faculty is truly committed to the training and the cardiology fellowship, and they feel that it's sort of the essence of our division.
I think one of the greatest parts of our training program is the fact that our fellows get to spend their time at two very diverse kind of hospitals in terms of the training experience and the patient population. At LAC, they get to see really the first presentations of chronic diseases and get to see how those play out in a very underserved population. Our fellows are incredibly passionate about the care they provide there.
One of the biggest assets for this program, in my view, is the association with the famous Los Angeles County USC Medical Center. There is more than a century association between USC and the County of Los Angeles. This hospital is an historical jewel for the population of Los Angeles County.
On the other side of the street, we have Keck Medical Center, which takes care of some of the more advanced diseases that are reached their kind of final stages. And I'm one of the faculty in the heart transplant and cardiology division, and I manage patients that are getting listed and worked up for heart transplant, LVADs, and other advanced mechanical circulatory support.
Here on the Keck side, we see a lot of patients that have really complicated disease, perhaps disease that they were getting treated for by an outside physician or facility, and that place has reached their limit, and so they come here for kind of more high acuity, high complexity care. So I think one of the biggest strengths of our program, one of the things I'm so proud of, is that we do kind of cover the entire breadth of patients. We, faculty, have a very collegial relationship with our fellows. They are our trainees and they're obviously educated by us, but I personally see them as colleagues.
One of the things that I cherish most about this program is the bonds that we develop, not only amongst trainees, but also with our faculty. We often enjoy spending time just getting tea between cases with our attendings, or hanging out outside of the hospital, and sometimes even visiting their homes. It really provides an opportunity to get to know them on a personal level, which I find to be very enriching.
What excites me about teaching fellows is I learn much more. I'm in charge of the Didactic program at LA County USC. And I think when you're sitting across the table and you see the interest and you see the curiosity, you can see it in their eyes when they get it. That's really one of the most rewarding things in teaching. So our Didactic program is broad and varied. So you will have formal lectures, you will have more casual board review and EKG reviews, you'll have journal clubs. So we really have a wide breadth of conferences and didactics.
I tend to give the fellow a lot of leeway, meaning you're the junior attending, what would you do in this instance? I feel like there's a lot of growth that can occur in that.
This place really teaches you to, think critically and act decisively. I think in several months when I graduate, I'm really going to be ready to go out into the community and practice as an independent cardiologist.
It's kind of amazing to see fellows when they first start, and then by the time they become third years, they're incredibly confident and competent. So that to me is kind of one of the things that I love seeing in fellows, is that they blossom over the course of the 3 years that they have with us.
So the sky's really the limit in terms of where our trainees go after they finish their fellowship here. They are really well prepared for life either in academic medicine, community practice, health policy or administration, and they end up in areas throughout the country. They definitely exceed the procedural volumes that they need to excel in whatever they choose to do. We also have several fellows that decide to go on to subspecialty training in either interventional cardiology, advanced heart failure and transplant, or electrophysiology, and they are quite successful.
For me, something that I was looking for in a program was a place that I would have strong mentorship and a place that would help me find kind of the best career for myself. And I was quick to learn on my first day coming to campus that each fellow is put into a mentorship firm. And that's a small group. Fellows from all years are represented along with attendings that get together. We're able to talk about just kind of what your career path is, what you need to get there, different research opportunities, and even just how life is and how things are going outside of the hospital.
So there's definitely really exciting opportunities here and definitely easy ways to seek out how to get involved in research. We have faculty members that participate as PIs in major clinical trials. We are involved in multi-center research projects. So very early on, I joined a heart failure research group, which has been really productive. And in the past year, we've done retrospective research projects that have been ultimately presented at both national and international conferences. And it's been really fun being part of that.
My favorite part about living in Los Angeles is honestly the enormous amount of things to do and see in not only the city, but in the surrounding area. You know, within an hour, you can go to wine country, you can go to the beach, you can go to Malibu, you can go to museums, concerts, sports. Just the great food that's in the city is kind of on par with some of the best cities in the world.
I've been here now for actually 13 years. I did my undergraduate at USC. I did my medical school at the Keck School of Medicine. I did 4 years of medicine and pediatrics residency here at LAC+USC. And now I'm on my first year as a cardiology fellow. And I can say that there's absolutely no better place to be a doctor or train than here at LAC+USC. For me, the reasons are number one, the patients. There's no more rewarding work than to serve a patient population that has been through as much as ours has. People come here from all over the world, oftentimes just to get care here at LAC+USC. They know that we'll treat people regardless of their income, their socioeconomic status, and that we're here to serve. And that sort of leads into reason number two. There's a serious sense of mission here at LAC+USC that we provide outstanding care at a tertiary care center to the most underserved patient population in a large urban setting. This is an outstanding place to do training. I love being here and I couldn't recommend it higher.
Here at LA County USC Cardiology Fellowship, our staff, faculty, and other colleagues are committed and have a passion to train the next generation of leaders in the field of cardiology, and we're excited to meet you.